All right. And then I'm going to, there we go. And you should be able to see my screen. And yesterday, one of the things we learned was void means to urinate, right? And urinate is pee. And pee and urination and void all are the same thing. This macutration. I'm sorry, 1 second. Really stand up 1 p.m. Oh, he keeps changing the time. Okay, so now we're back here. And we talked about yesterday how water was our urine is 95% water. It's basically what you're putting in, your body is using, and you think, well, 95% water, so is that all the water that I drink? No, actually, that's just a very small percentage. But because when we urinate, we don't usually urinate as much as people think that they do. Because how much did I tell you that the bladder could hold? About 16 ounces. So if the bladder can only hold 16 ounces, that is definitely not all of the fluids. Well, hopefully not all the fluids you've been drinking. Hopefully you've been drinking a lot more water than that. And then we talked about how some of it is broken down into other percentages. This urea, creatinine, ammonia, and uric acid. And I told you when those levels are abnormal, there could be something wrong. And then the rest of this is like salts and the debris. And we're going to go over this when we talk actually about urine itself. But today we're going to start with the common disorders of the urinary system. Remember, if y'all have any questions, please feel free to stop me and ask. Okay? But these are some terms, and I want you to know these. These are common terms. These are terms that you should know and be familiar with. Okay, so if you don't know them, I want you to write them down. Make sure you come back and you take notes on them. Anuria is the first one. And this means that there is no urine being produced at all. All right, the patient is not urinating. There's no excretion. All right. Dys, now we remember that means pain, right? So dysuria, painful or difficult urination. Enuresis, that basically means that if you, say you're already potty trained as a little kid, and or even an adult, and you begin to have loss of bladder, and you lose bladder control, that's enuresis. I gotta have y'all mute your mics, okay? The enuresis can happen because of infection, or it could happen because of a neurological disorder, something like that, okay? Hematuria means blood in the urine. And then nocturia, and you think of nocturnal, so that's night, right? Nocturia is when you have to excessively get up and urinate in the middle of the night, and that's considered, 1 second, that's considered more than once a night. And then there's pyuria. Pyuria is when you have pus in the urine. And of course, that doesn't sound fun, and it's not something that we want in our urine, right? So make sure you go through these and you do know them, okay? The first thing we're going to talk about is something that probably every lady, at least once in their lifetime, is unfortunately going to experience, and it's called cystitis. And it's basically the medical term we use for inflammation of the bladder, but it's also interchangeable with urinary tract infection. Because if we have cystitis, there's a reason that we have an inflamed bladder, and that's usually due to infection from a UTI. Now, if you didn't know that a urinary tract infection is abbreviated UTI, and if that's what UTI stood for, please make sure you write that down. That is a very commonly used abbreviation. Now, with cystitis, I've had several doesn't even begin to cover it. I used to have chronic, constant urinary tract infections, and I'll tell you why. It was because I had what they call tiny little ureters, and so the longer it took the ureters to bring the urine down, and then when it was stored, it was more time for bacteria to grow. Another thing that I found out is, ladies, after intercourse, you should always urinate. Never leave your bladder full after you have sex, because having sex can introduce bacteria into the urethra just because of the friction and the motion. And peeing helps clear that out. So if you don't do that, make sure that's a habit you pick up. You'll need it as you get older. Women between the ages of 20 and 50 are the most prone to UTI because of sexual activity. And that's what I was saying. Being able to get up afterwards and go pee, even if you feel like you don't have to, sit there until you urinate. It will make the difference, especially if you're somebody who has a lot of UTIs. Now, so what's kind of different is when we see a UTI or cystitis in men don't really get urinary tract infections. And the reason, it's not saying they can't, but they just normally don't. When they have cystitis, it's usually secondary, meaning that it is an infection caused because of something else. And like a STD or a bad systemic type of infection or kidney infection, something like that. Now, what are the symptoms? I could tell you this in my sleep. I've had so many UTIs. What it feels like is, oh, I gotta go pee. So you go sit down and you go pee, and you go to the bathroom and you take out, whatever time you gotta take out of your day. And you get in there, you pull down your pants, you're ready to go, you sit down, and nothing happens. You're like, well, I've gotta pee, but nothing's coming out. And then maybe you get a drop. So you stand up, pull back up your pants, go to wash your hands, and you're like, I gotta pee. So it's this constant, persistent urge to urinate. And then when we do urinate, when you have a UTI, it's painful, or dysuria, because it burns. And then when we do, like I said, are able to pass a bit of urine, it's just a tiny bit. It's not that full release. And sometimes we even, because of the infection, can get hematuria. Now, hematuria is not blood in the urine because of menstruation. Hematuria is blood in the urine because of infection, inflammation, something like that. It is not related to menstruation, okay? With cystitis, sometimes the urine, this is why when you do go to lab and you start working with urinalysis, it sounds gross, but when you take the lid off of a patient's urine, if a really foul smell comes up, could be a very strong sign that they have a urinary tract infection. If it's real cloudy, that can be a sign. Sometimes a patient might have pelvic pain, pressure, a low-grade fever. Now, here's the key thing with kids. Kids aren't going to come and tell us all of this. So what we usually see with this, especially small girls, is they'll be potty trained and they'll be completely using the bathroom on their own, and then all of a sudden they start having accidental bedwetting or accidental accidents in the middle of the day. Those could be signs of a UTI in a little girl. So if that starts happening, you should be checked out by a pediatrician. So what is the treatment? Usually, you'll go in, the doctor will run a urinalysis and see, okay.
I have a question. So is that the same situation with boys also, like urinating at night, like peeing the bed? Would that be a cause for like to check for UTI or no?
Boys, okay, it would be something, of course, you'd want to rule off, okay? And especially based on age. Now, but what I will tell you, having 3 boys, is that we had bedwetting with one of my sons until he was 7 or 8, and it's just that boys don't usually have that same urging sensation
as we do,
as what a girl will have, and it is much more common for boys to wet the bed.
Okay.
And I had another son. He was completely potty trained, and then once in a blue moon, up until 10, he woke up. He's like, "This is so embarrassing," and I was like, "It happens," and it wasn't anything wrong. It's just he slept so sound. But if it's a once in a while type of thing, that's not really anything to worry. If it's something that's happening and reoccurring, and they're over the age of 6, 7, then yeah, I would talk to a doctor about it. Make sure that it's not like a UTI. Make sure that it's not anything other than just bedwetting. And I'll be honest with you, when it comes to bedwetting, it's something that you never want to. It's really easy as a parent to chastise and to fuss at the child, but it is definitely something that you don't want to do. Your best bet is to go get a plastic bed liner and cover your mattress, and then you can actually even buy just pull-ups, or you can have if you get, I mean, that's if you're, because washing sheets, trust me, I know, every single day it was a lot.
Yeah.
Or the other thing that you can do is they have what are their medical grade chucks, and that you can place them under the kid. So all you have to do is dispose the chuck at night and wash it. Okay. So there are things, but the main thing really with them is really try not to. I've seen parents who have punished children for it, or different things like that, and we found out psychologically that can really mess them up. Go look at some of your serial killers.
Okay.
They were bedwetters who were abused, and well, they had other things too, but try not to, like I said, make sure you try to be understanding of the kid with that. Like I said, but it does get frustrating. Trust me, I know, especially when you're washing. We had my middle son, Brandon. He was the one that it was just the worst with, and like I said, it was off and on. I think the last time he was maybe 12, But it was until he was 7 or 8, it was every single night. Every single night we were washing. And then finally I was just like, I ain't doing this anymore. We had the bed protector to protect the mattress, but every day it was washing sheets. So I bought him and he was embarrassed. And I told him, you don't have to tell anybody, blah, 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 this kind of thing. I said, but I don't have the time to continue to wash these sheets. I said, this is something the doctor thinks I shall outgrow, and well, try to keep it private, try to keep it discreet. But yeah, we had to put him back in like a sleeping, pull up at night. So he'd kill me if he heard me say that, but that's okay. He's still mad at me. He hadn't talked to me, and his birthday's in a few days, so yeah. But yeah, if it's always check a doctor, make sure it's not, something underlying. When we look at our bladder, okay, we're looking here, and this is of course a male bladder. So we're looking and we can see this is normal. There's no redness, there's no inflammation, there's no irritation. And then you see the prostate here. And then with this one, you can see inflammation, you can see irritation, and even some bleeding. Now, remember when I was telling you as men get older that their prostate can enlarge. And one of the reasons it'll always, they'll have problems is because also, as we get older, our bladder, everything, gravity takes effect on things. It can really affect the positioning and the size and the weight of the bladder, and it can press on the prostate as well for older men. So we can see the difference between a healthy bladder and an infected bladder, and it's painful. Okay, so cystitis or urinary tract is going to be something that is usually symptomatic. Now, I said that, but could you have a patient who has a urinary tract infection but did not have any signs or symptoms? Yep, you very well could. And that's rare, but maybe they just completely overlooked it. They didn't realize what they were looking for, or they were very mild symptoms. So that is the case at times. All right, the next thing we're moving on is to glomerulonephritis. And basically, this is a group of diseases. So we kind of lump them together. Whenever we think of neph, remember I told you yesterday, think of the kidneys, what inside of each one of the little kidneys we have not neurons, nephrons, and that's where that neph comes from. And then of course itis is inflammation. So anytime we have a disease or a condition that affect the filtration, the glomeruli, we're going to kind of group them into the same category. And sometimes you just might hear it referred to as a nephrotic syndrome, right? Now, sometimes it's not because of an illness, sometimes or disease. Sometimes it's strictly injury, like a trauma, car wreck or something. And our kidney has the ability to, with time, a lot of times it can heal and get back to a normal working state. And we'll talk later how if this gets too severe and your kidney's not filtering, then it can result in kidney failure to where the kidney's not working at all, and the patient may need dialysis, okay? So anything that's dealing with some kind of condition with the nephrons, those filters. That's, that's a nephrotic syndrome. Kind of group them all together, and there's multiple things. Usually these patients are going to come at you, and you're going to be able to see that they are ill. They are not going to look bright-eyed and bushy-tailed. They might have abdominal pain. They could have blood, either vomit or stool, shortness of breath, excessive urination, fever, fatigue. And this is one of these three right here are the ones that I really want you to focus in on. When you look at their urine, if you ever see dark, I'm sorry, my cat's having his moment again, dark rust-colored or brown foamy urine, that's a bad sign, okay? And a lot of times these patients will also have edema of the face, the eyes, the ankles, the feet, and even ascites. Remember, that's abdominal swelling. These patients are ill, and it's because they're not filtering. The body is actually becoming septic because it's not getting the filtration that it needs. For glomerulonephritis treatment, well, the first thing we need to do is find out the underlying cause. All right. And we already know that these patients who have this, they're going to have high blood pressure. Because remember when we talked back and we mentioned, and I said that blood pressure and kidney function go hand in hand. Because if your blood, right, there's a filtration process. And if we're having either the kidneys overworking or if the heart's underworking, not doing its job, one of the two, you're going to start seeing signs in one of those symptoms, in one of those organs, right? So we don't want that. And we see our patients come in with those symptoms. So our first thing is, okay, what's going on? Is this kidney issue? Is this cardiovascular issue? Is it both? Is it blood pressure? So finding the underlying reason. Steroids, like corticosteroids, will help. And believe it or not, drugs to suppress the immune system. Because sometimes this can be related to some type of autoimmune disorder. Does anybody remember which autoimmune disorder attacks the kidneys? Bonus points? No. It was lupus, right? Lupus is the autoimmune disorder that attacks the kidneys. And here is that brown, rust color, foamy urine, okay? This is, when you see this, and if it's a man, you're automatically worried, okay? If it's a woman, you're going to tiptoe back in there and go, if you didn't already ask, which you should have, what was your last menstrual period? Are you on your period by any chance? And if they were like, oh no, or this or that, or then you're going, okay, thank you, close the door and go back in there and let the doctor know, because this is not a good sign, okay? Urinary incontinence. This means you're not able to hold your urine like you used to could. Now, the bladder we know is a muscle. And I talked yesterday about how that the bladder opens and closes and lets urine out via the urethral sphincter. And then we pee through the urethra. So if that sphincter becomes weak or loosened, if the bladder begins to fall, which is common in women. If you had a big baby, like we're talking 8 or 9 pounds or more, you are very probably, pardon me, I keep hiccuping, going likely to experience urinary incontinence. I've had it for the last 5 or 6 years, and there's nothing I can do about it. Sarah was 9 pounds 4 ounces, and she literally, after I had her, I was okay. Then I had Brian, and I was okay. I would still once in a while, if I laughed or sneezed, I'd tinkle a little, but it wasn't that bad. But the last 5 or 6 years, now it's become worse and worse to where I have to wear a panty liner because sometimes it leaks, and that's part of the main reason for me, I was told, is obesity. If I lost some weight, it would take off some of the additional pressure and so forth of the bladder and that kind of stuff. So another reason why to lose some weight. But also, just as we age, this happens and this can become. Now, there are, like I was mentioning yesterday, the Kegel exercises to build that pelvic floor. I'm trying to always remember to do them and, keep the muscles firm and tight. But like I said, unfortunately, this is just something women deal with. It is part of getting older. Now, there are different kinds of urinary incontinence. Now, I want you to know the different kinds, okay? Now, urge incontinence means you feel like you've got to go, and there's sometimes like a spasm or contraction of the bladder, all right? And it's usually a persistent nagging feeling. That's horrible, right? And then there is the more common, what I have, stress. Stress incontinence is when you dribble or tinkle because you laughed, sneezed, coughed, something like that. Now, can a person have a combination? Yes, they can. Okay, so it is a possibility to have both. So urge, pardon me, and stress. All right, and what we're seeing with both of these is that they put pressure on the urethra, and they put strain, and so that's what causes the the leakage in the bladder. And it's like I said, sometimes it's something that can be fixed. There are medications. I talked about all of these. Yeah, I talked about this. There are medications and treatments that a woman, or sometimes men have this too, it's not just women, that they can do, is that pelvic floor exercise like we talked about. There are medications that can help to be able to correct the nerve stimulations that's happening. Self-care, like being able to frequently use the restroom more often, or absorbent pads. What this scheduled toileting is like set a time. I'm going to go here, then. And then double voiding. Double voiding is when you're taught, and this is, if you work for a urologist, it might be something that you actually teach a patient. You're taught to pee, right? And then hold, then it's I can't remember the process. It's either pull up on like the area, or stand or tilt, lean forward slightly, and then begin to void again. And it's something like with that process, I'll have to go back over, but I will be posting a video about it. And then bladder training, and I'm going to post videos about this either. But I want to pop back real quick. Remember enuresis, that's incontinence or at night, okay? Now, could a person begin to have this and be young and have no type of issue, never been pregnant or anything? Yeah, that can, like I said, that could happen because of medical conditions, health problems, or even infections. And certain medication can cause that too. Certain medications are known to cause you having bedwetting accidents. All right? And then I'm not going to get into kidney stones today because we'll take time with then more detail with that than that, because I'm already at 35 minutes. But I appreciate everybody coming here, and if you haven't done your SurveyMonkey, please make sure you do so, and I will see all of y'all again tomorrow for lecture. Okie dokie. Y'all have a good day. Bye-bye.